If you've been struggling with a painful, stiff shoulder that just won't seem to move like it used to, then this video is for you. Today I'm going to talk about frozen shoulder, also known as adhesive capsulitis. I'll explain what it is, why it happens, how it's diagnosed, and most importantly, what you can do about it, including a set of exercises that you can do at home to help get your shoulder moving again. If you're new to the channel, then welcome aboard. I'm Stephen Bunting and I'm a specialist MSK physiotherapist working in the UK. Here I discuss the common MSK conditions that affect everyday people and the evidence-based treatments that can help. Frozen shoulder is a condition where the shoulder joint becomes painful, stiff and difficult to move, almost like it's stuck or frozen. It happens when the capsule that surrounds the shoulder joint becomes thickened and tight. In a normal shoulder, the capsule is a sleeve of soft tissue that surrounds the shoulder joint and helps keep everything in place. It's usually quite lax and saggy, which allows the huge range of movement available in our shoulders. But in frozen shoulder, this capsule thickens and tightens, almost like shrink wrap. It essentially glues itself down or adheses to the underlying shoulder joint, which is where its official name of adhesive capsulitis comes from. The condition typically goes through 3 distinct stages, and the treatment depends on which stage you're in. So pay attention to this bit because I will be coming back to it later when I talk about the treatment options. So stage 1 of frozen shoulder is called the freezing stage, and the main symptom of this stage is pain. So this is where the shoulder becomes more and more painful, especially when trying to move it. So in this stage, the capsule is angry and inflamed, and the pain can be really severe. Frozen shoulder sounds quite innocuous, doesn't it? But the pain from a raging frozen shoulder in that early freezing stage can be one of the most painful conditions that we see in the MSK world. And it can last from 1 to even 6 months. So it's going to be really painful to move your arm in any direction, and sleep is probably going to be disturbed. Stage 2 is called the frozen stage, and the main symptom of this stage is stiffness. So for most people, this is a major relief because the pain has finally settled down and you can now sleep better, but the stiffness sets in. So in this stage, the inflamed capsule calms down, but it becomes tight and fibrotic, so you're going to struggle to lift your arm away from your body, take it out to the side, or take it behind your back, so things like tucking a shirt in, fastening a bra, or combing your hair are going to be difficult. This is the longest stage and can last an average of 6 to 12 months. And finally, there's stage 3, which is the thawing stage. So now the pain is pretty much gone and the stiffness finally starts to loosen up. This can take an average of 3 months, but in the end, your shoulder should have fully recovered. Although it has to be said that some people never quite get their full movement back again, particularly after a nasty frozen shoulder. They might just lack that end range movement for the long term. So unfortunately, a frozen shoulder can take between 1 and 3 years to go through these 3 stages and get better. But the good news is that most people do get fully better over time. The other bit of good news is that the early freezing stage doesn't last too long in most people, and once that stage is over and you're into the frozen stage, then the pain usually drops right down, and despite the stiffness, most people are now fairly relieved and relatively happy and comfortable. So why does frozen shoulder happen? Well, the truth is we don't fully understand all the reasons, but there are some clear risk factors. It's more common in people aged between 40 and 60. It affects women slightly more than men. People with diabetes or thyroid problems are more likely to get it, particularly poorly controlled diabetes. It can also occur after a shoulder injury or surgery, especially if the shoulder is kept still for a long time. But most commonly, frozen shoulder develops without any obvious cause, which can be really frustrating. But here's the key point. Frozen shoulder is not caused by poor posture, sleeping awkwardly, or lifting something too heavy, so it's usually not your fault. It's a medical condition that can happen to anyone. And there's one other bit of bad news. If you do have a frozen shoulder, then there's about a 20% chance of getting it in the other shoulder within 5 years. But that's an 80% chance that you won't, so fingers crossed. Frozen shoulder is a clinical diagnosis, meaning that in most cases it can be diagnosed based on having the right symptoms and examination findings. Imaging is not usually needed, although I will usually x-ray a frozen shoulder just to rule out any bone or joint abnormality, such as arthritis, fractures, dislocations, and some rarer bone conditions, as these problems can mimic the symptoms of frozen shoulder. The most important clinical feature of a frozen shoulder, though, particularly in the frozen stage, is a lack of external rotation. This is the movement where the shoulder rotates outwards like this. So to check this on you, just tuck your elbows into your sides, bend your elbows to a right angle, and then rotate your shoulders outwards. So you can see here that in the left shoulder, I can fully rotate outwards, and the normal range is between 70 and 90 degrees. But in my right shoulder, it's only rotating out to about 10 degrees. And this is the cardinal sign that you probably have a frozen shoulder, especially if your x-ray is otherwise normal. The other movements that will be stiff are the hand behind back movement and the elevation movement. Right, let's talk about the important bit. What can you do about a frozen shoulder? Well, the main treatments focus on two things: managing pain and then improving movement and strength. So let's go through a step-by-step plan. Before we get started though, I will say that in my practice, once I've explained these 3 stages to my patient and highlighted that frozen shoulder usually gets fully better over time, some patients, especially those with milder symptoms, will be happy to be reassured and allow the passage of time to be their treatment. And if that's you, then you can stop watching now, and that's absolutely fine. Put the problem to the back of your mind and allow nature to take its course. For the rest of you though, and particularly those of you with severe symptoms, stick around and I'll go through the treatments. So if you're in the early freezing stage, then pain is likely to be your main problem. And like I said earlier, it can be really severe. So the simple things you can do immediately is to use pain relief medication and anti-inflammatories if you can take them. But make sure to speak to a prescriber or a pharmacist if you have any doubt. Now, please don't discount the importance of this. Taking a simple painkiller like paracetamol or something with a bit of codeine like cocodamol, combined with an anti-inflammatory drug like ibuprofen or naproxen, can be really helpful. But you must, and I need to stress this, you must take them at maximum dose and at the right time. So if it says 2 tablets every 4 hours on the packet, then that's exactly what you must do. The main reason why painkillers don't work as expected for most people is because they take them infrequently, as and when needed. So the therapeutic effect never gets a chance to build up and be maintained. So that's a really important point. Take your pain meds regularly. The next simple thing to try for yourself is using ice or heat. For most people, heat will help, but occasionally I see people who get better pain relief from using an ice pack. So try each and see for yourself. There's no right or wrong in frozen shoulder. And the last pain relief option is a cortisone injection. And indeed, if your pain is severe and disturbing sleep, then an injection is going to be your best option. It can really put the fire out in an angry frozen shoulder. It's not going to help with the stiffness much, but for pain it can be really effective, and I will offer one quickly to most of my patients with a painful frozen shoulder, especially if sleep is being disturbed, which is a horrible situation to be in. So don't suffer needlessly. A cortisone shot can really help. Now, if you have the option of getting this done under ultrasound guidance, then that's usually better for accuracy, especially if the shoulder is also very stiff, because the needle has to get underneath the capsule, which often gets tight and stuck down as the condition progresses. And indeed, if you've had an unguided injection that hasn't helped, then it's probably because the needle didn't quite get underneath the capsule and into the joint cavity. Once the pain is under control and the condition is now moving into the frozen stage, then the emphasis for treatment starts to shift towards maintaining and then improving your shoulder movement and strength. And this is done by doing regular stretches and exercises, because the evidence is clear. Movement is medicine, but you have to start slowly and not push into pain too aggressively. Now, to save time in this video, I've done a separate video demonstrating a full program of exercises for all 3 stages of frozen shoulder, and you can find that up here, or I'll put a link in the description below. In severe cases of frozen shoulder, where the pain and stiffness just won't settle despite trying all the treatments we've discussed, then there are a few interventional options that a specialist can provide that might help. So this might be either someone who is stuck in the freezing stage and is still in severe pain that's showing no signs of improvement after 3 to 6 months, or someone who is stuck in the frozen stage who still has a very stiff shoulder that hasn't thawed after about 3 years. So the first thing that might be tried is a procedure called hydrodistension. So this is a specialised procedure where a needle is placed under the joint capsule using ultrasound guidance, and then a large volume of fluid, usually a mixture of local anaesthetic and some sterile water, is injected under pressure into the shoulder joint, with the intention of trying to stretch the capsule from the inside outwards. It doesn't work for everyone, but I've had some great results from using this procedure, and it's minimally invasive with very few side effects and complications, so it's often worth a try. If it doesn't work, then the only remaining option is going to be surgery. So a surgeon can carefully cut away at the tight capsule in an effort to free the shoulder off and restore movement. It's a procedure called a capsular release, or it's sometimes called a rotator interval release, and it's done as a keyhole procedure, usually under general anaesthetic. Historically, a procedure called a manipulation under anaesthetic, or MUA, was once used to achieve the same thing. This involved putting the patient to sleep and then literally wrenching their shoulder into the stiff positions, essentially tearing the tight capsule. But we've since learned that while this might tear the capsule, it can also tear some of the other structures in the shoulder that you don't want tearing, like the rotator cuff tendons, which can then cause further problems in the future. So an MUA is really not advisable in modern healthcare, and I wouldn't recommend it. Before we wind things up, I just need to mention diabetes, because a diabetic frozen shoulder can be a real problem and can often take twice as long to get better compared to a non-diabetic frozen shoulder. And the symptoms and your length of recovery will be worse the poorer your diabetic control is. Indeed, if your HbA1c blood test is consistently over about 80, then you need to urgently prioritise your diabetic control over every other treatment, because it's the high circulating blood sugars that will be driving the condition, and unless you do something about this, nothing else is going to help much, including all of the treatments that I've discussed. And those interventional treatments won't be offered because they just won't work. So it's really, really important to get your diabetes under good control. Okay, so to wrap up, frozen shoulder is a self-limiting condition, which means it gets better over time in the majority of cases, but you can help it along by staying as active as you can. Don't push through severe pain though, but don't avoid using your shoulder altogether. Keep it moving within your pain tolerance, but do get help if pain is a real issue. An injection can give great pain relief. And be patient. It's a slow process, but the exercises I've shown you today will make a real difference if you do them consistently. And if your pain and stiffness aren't improving as expected, or if you're really struggling to cope, then do see a healthcare professional. Options like physiotherapy, injections, or even surgery might be an option. Okay, well that's about it. If you found the video helpful, then please give it a like, leave a comment, and share it with anybody else you think might benefit. Well, thanks very much for watching, take care, and until the next one, bye for now.